The World Health Organization is warning of a second wave of coronavirus outbreak as over 100,000 confirmed cases have been reported worldwide each day. Director General of the WHO, Dr. Tedros Ghebreyesus, in his latest address mentioned that it took over 2 months to reach the 100,000 mark, but now that is a daily norm. He cautions the world leaders to stay alert to the possibility of a resurgence.
Globally, more than 7.8 million cases of COVID-19 have now been reported to WHO and more than 430 deaths. It took more than 2 months for the first 100,000 cases to be reported. For the past 2 weeks, more than 100,000 new cases have been reported almost every single day. Almost 75% of recent cases come from 10 countries, mostly in the Americas and South Asia. However, we also see increasing numbers of cases in Africa, Eastern Europe, Central Asia, and the Middle East. Even in countries that have demonstrated the ability to suppress transmission, countries must stay alert to the possibility of resurgence. Last week, China reported a new cluster of cases in Beijing after more than 50 days without a case in that city. More than 100 cases have now been confirmed. The origin and extent of the outbreak are being investigated. Despite the ongoing global response to the COVID-19 pandemic, we cannot lose sight of other significant public health issues, including influenza. Influenza affects every country every year and takes its own deadly toll. As we enter the Southern Hemisphere influenza season and begin planning for the Northern Hemisphere season, we must ensure that influenza remains a top priority. Co-circulation of COVID-19 and influenza can worsen the impact on healthcare systems that are already overwhelmed.